So good afternoon, everyone, and thank you very much for joining the second of our Green Ribbon webinar series today. This afternoon, we're going to be looking at addressing stigma in the workplace. We have a really great panelists for you to meet. Four really interesting people, two employers who have done our workplace program, and then two trainers who actually deliver the workplace program. I want to just at the outset thank as well the staff who've helped organise this. Webinars actually take quite a lot to pull together. So thank you to Alma, who's doing all our IT in the background today, and to Kieran and Karen, who are the powerhouse behind the Green Ribbon campaign. And we also have Jacinta on the call, who runs our workplace program. So I'm going to tell you a little bit about Shine, a little bit about the Green Ribbon campaign, and then very shortly hand you over to our panelists. And we will have a short Q&A at the end if we have time. I also want to acknowledge that today is World Suicide Prevention Day, and we'll talk about that if we have time a little bit at the end as well. But it's an important day in the calendar, and I'm delighted that we have so many people joining this webinar today. So Shine was founded nearly 40 years ago, and we've been working in the area of mental health ever since. We support individuals who have lived experience of mental health difficulties and their family members and supporters. We do this through recovery services, which we provide throughout the country, and through a number of programs that we run to reduce stigma and help improve recovery rates. And one of the key programs that we run is the workplace program. So the next slide, Amma. So to go into a little bit of detail about our programs, first of all, providing support for people, we do it in a number of ways. We have a support line, we run one-to-one recovery services nationwide, and we have our groups. We also do a significant amount of advocacy, and a key part of that is our Green Ribbon campaign, which is running this month. You can order green ribbons or wristbands on shine.ie. They're free of charge. It's a program that the HSE task us to host every year, and we're really proud of the work that we do on it. Another really key piece of work that we do is called the Ambassador Program, and this is where people who have lived experience of mental health difficulties come to Shine, and we work with them in order to talk publicly about their experiences. The Ambassador Program is really often described as a game changer in the work that we do, because hearing the story of someone who has had a mental health difficulty really helps to reframe how we as a society think about this. And it's also really important to start these open conversations in relation to mental health. We also do a number of training courses, both in the community and in media, and of course the workplace program training. So just to talk a little bit about the Green Ribbon, I don't know if many people here are watching the golf over the weekend, but there were some golfers wearing green ribbons on their baseball hats. And the green ribbon is the international symbol of stigma reduction around mental health. And we run that program here in Ireland. And it's actually really important for a number of reasons to have this visible symbol that people can see. It encourages conversation. It really challenges negative perceptions and self-stigma around mental health. It encourages conversations. We've all had really great experiences when we are out and about wearing our green ribbons about having those important conversations. And it helps to create this national movement around reducing stigma when it comes to mental health. So for the whole of September, we'll be running this campaign, which includes a series of webinars. This is the second in the series of webinars, and we have two more coming in the next 2 weeks. You can register for the webinars on our website, and if you just click the next slide there, the QR code to be able to register comes up. And this webinar today is obviously on the workplace, and it'll be on our website if you want to look back on it. And also if you want to register for any of the upcoming webinars, just scan the QR code there. So I'm going to introduce you now to our panelists, and the first panelist we have is Austin O'Sullivan from CARE. So CARE has done the workplace program recently, so I'm really looking forward to hearing from Austin on how he found that experience. Just to let you know a little bit about CARE, CARE supports people with intellectual disabilities and their families to create a life that fulfills their personal potential. And they provide this support to over 550 children and adults throughout Leinster. Austin is the HR manager at Care and has been working in HR for about 3 decades now, so hugely experienced in this area and is also a fellow of CIPD. So I'm going to hand you over now to Austin.
Thank you. Yeah. So I suppose I would have joined Care around the end of 2023, and I suppose what would have recognised through staff survey that we had done, that had been done before I arrived in 2023, and then another one we did early in 2024, that mental health was something that we needed to kind of look at. We're also looking at our kind of our sick absence data, and looking at having kind of anecdotal evidence from talking to managers and talking to staff, kind of indicated that this was an area that we needed to look at. So it would have been around mid 2024 that we would have first engaged with the Shine Workplace pledge. And I suppose what I was looking for was a roadmap and some kind of guidance to kind of support us to kind of challenge the kind of stigma of mental health as it was kind of showing itself in the workplace. And also the areas that kind of stood out for me was, a culture of silence, where mental health issues or mental illness wasn't spoken about, tended to be brushed under the carpet, and for that reason, issues weren't dealt with in a proactive way. It often took a long time before the proper supports were offered to people. One of the factors in that, I suppose, was staff's reticence about having any reference to mental health on the medical asserts that actually came in. And we would often, when it came to referring staff to occupational health, we were often dealing with issues that weren't that kind of root of the actual problem. When we kind of tried to kind of unpack that a little bit, what I kind of found was that managers weren't comfortable about having mental health type conversations. And a manager is forced to port a call if anything, if any conversation started to stray into one about mental health, would have been to refer them to our employee assistance program, which was really kind of outsourcing the problem rather than us, supporting the person. There's also kind of evidence of stigma in relation to how conversations were had about people who had come forward with mental health difficulties in the past, where there would be some kind of prejudgment then made on their capabilities in the future. So saying, oh, so and so, I don't think they'd really be able for that job because of X, and X might have been an event that happened in a person's life in the past. So it was kind of stigmatizing people. So that was an issue that we needed to bring up. And he was kind of evident among our kind of male staff, this kind of macho culture around, there was no stigma around reporting having the flu or any physical illness, but to kind of report anything that was a mental, a mental difficulty, whether that was a work related stress wasn't coming true. And kind of we didn't really have any kind of structures in place, so we didn't have any our HR policies weren't kind of designed to support a cover of a real model. So I suppose through our engagement with the Shine Workplace program, we provided mental health awareness training to all our leaders. And this was a really important first step, because often, it is the leader who's the first person who's going to have that conversation, the person who usually might kind of notice something for first, and kind of upskilling the leader so that they were comfortable having those conversations was a really important first step, and a very important first step in creating a psychologically safe environment where staff are comfortable to discuss issues that were impacting on their work performance, and to encourage leaders to kind of model vulnerability, both in their one-to-one conversations, but also at kind of staff meetings where, taking the time to actually kind of check in with the team, acknowledging when there were stressful periods, and being aware of work-related issues that may be a factor in poor mental health, and then working with people to kind of make reasonable accommodations where they're needed. So in addition to having those kind of sessions for the leaders, we also held awareness training for our staff. So it was important that staff got the message that we were trying to create a culture of kind of openness and acceptance around mental health, and for kind of teams to take the well-being of their team as something that each team would be responsible for, in terms of identifying what was important to that team in keeping themselves well, and then having a section where you're kind of talking about that at the team meeting. So creating that kind of peer support for people. Around the same time frame, we were redesigning what had been a very traditional performance management process, and through our kind of discussions and our kind of increased focus on kind of well-being, we actually put a well-being section into our new process, which is actually changed to now being a staff annual review and selection process, which has your workplace well-being as the first part of that, where we would kind of provide the guides to a conversation around your kind of workplace well-being. So kind of we see, very much as a kind of a three-strand approach to supporting well-being and supporting mental health. That's what the organization can do in terms of policies and kind of annual review processes and kind of regular check-ins with your leader. That's what each team can do, and then there's that peer-to-peer support. And another important thing I think we did was we produced a staff positive mental health policy, which set out our commitment to a supportive partnership approach to mental health. And that's the first time we ever had anything like that in the organization. So it's very clear to people what they can expect from the organization and how we will support people, how we will engage with people and any professional teams that are working with them to support them back into work. We also trained several mental health first aiders from across the organization, really to offer that kind of confidential next level mental health support. And then it's very important for us that we engage in the Green Ribbon Month, and that's led from the top down. So it's very important that our senior executive team, all the way down to our operations managers, all the way down to our front line leaders, wear their green ribbon every day to show their openness and their commitment to mental health. Because we can't be expecting our staff to engage if the signs and signals are coming from the kind of leadership. It doesn't support that. So that's just a very quick whistle stop tour of probably our last 18 months.
Oh, that's fantastic, Austin. Thank you. And it sounds like you've had such a brilliant 18 months as well. So much leadership being shown in that area and so much fantastic work. Thank you for that outline. It sounds absolutely fantastic. I now want to move to Sarah Hornby, who's joining us from a company that probably every one of us has in our house, and that is Fleetwood Paints. So Sarah is the compliance manager with Fleetwood, having responsibility for health and safety. Fleetwood is a family-owned business, started in the 1950s and based out of Cavan. So Sarah, I'll hand over to you now.
Yeah, how you doing? Thank you for inviting me today to be part of today's panel, which is addressing stigma in the workplace. I'm delighted to be talking today, given that it's also World Suicide Prevention Day as well. So yeah, I'm the compliance manager in Fleetwood Paints. I'm also a qualified mental health first aider, and I joined the company here in 2023. So Fleetwood is one of Ireland's largest indigenous paint plants. They manufacture paint here in Cavan. There's 155 people employed nationwide. We've trade depots in Dublin and Cork and Newbridge and Galway. There's people out in the road as well, sales and merchandisers. And as a family-run business, we're very kind of supportive and close knit in the workplace, and colleagues genuinely look out for each other. On average, when you're working in full-time work, you're kind of spend more time nearly with the people you work with than you do with people at home. So it's actually a really nice kind of family-friendly environment that we work in. And it's not uncommon to be walking through the factory and hear somebody shouting "ma'am." So there's lots of relatives and things that work here as well. So it's a nice area to work in. Stigma it's something that exists in society, but it shows up in the workplace too. It's often not visible. It's hidden in attitudes and assumptions and silence. And for us at Fleetwood, I suppose the staff attitudes were the biggest challenge that we had when we first began our journey. Um, People, they're not always comfortable talking about mental health, so there's a lack of understanding about some mental health conditions. A lot of people were worried they were going to be judged if they let their guard slip. And like everybody knows, the cost of stigma, it affects people's willingness to seek support. It impacts well-being. It leads to absenteeism and presenteeism and lower productivity across the board. The real impact, though, is human. When stigma is present, people can feel isolated, misunderstood, or even excluded. They feel scared to admit that they're struggling, and they feel like they have to suffer in silence with little or no hope of help or somebody understanding them. This not only impacts their work, but it can also impact their home life as well. So this is why we're so proud to be partnered with Shine. We've taken that 6-step pledge, and it has been a turning point for the company. Managers attended the workshops. We all attended ambassador talks, either in person or online. Since the beginning of the Shine journey, we've noticed a change in culture here on site as well. So employees are more open to talking about mental health. The conversations are treated the exact same way as any other health condition would be. Staff, they're also more open to talking with each other, and they have seen a positive impact on absenteeism. HR have also noted that they've seen a reduction in sick notes in relating to stress or in mental health, particularly in the last 6 months. In the canteens now, you can hear colleagues having open conversations about life-changing challenges and supporting each other. And it's normalised the mental health conversation, which is one of the biggest changes that we've seen. Our EAP system has been promoted more, particularly since we started this journey. And there has actually been an increase in use in this service as well from it. So it's good. Some of the steps that we've taken, we have 11 trained mental health first aiders on site now, and that's across the board. So there's people that our staff and our colleagues and stuff can go to. They'll listen, they'll provide support, and they can signpost people to the relevant organisations now as well. We've updated the employee handbook, and there's a dedicated mental health policy in this. We've rolled out green ribbon activities. We've had bake sales. There's been talks from the Shine ambassadors. Eamon Maloney was talking. We've distributed the green ribbons to every site and all the depots across the country as well. And that's to spark the conversation and show solidarity as well. We created a wildlife area, and we have a 1 kilometre riverside walkway that staff can use on their breaks, just to support their own well-being as well, and just to get them out of the office or away from the environment that they're in, just for a couple of minutes, just to get a breather. There was dignity and respect workshops ran towards the end of last year, the beginning of this year, and these gave staff the tools to call out language or tone that wasn't respectful, understand the impacts of behaviours on others, and strengthen everyday respect and dignity on how we work together. Out of this then, out of the workshops, there was communication forums that were ran, and like we have an awful lot of long-term employees here that have worked here 10+ years, and then on top of that, a lot of people, this would have been their first job, so they've come out of school and they've started working here. So the feedback was generally positive from them, but it was especially positive from the new employees that had come from other jobs, where they said that they hadn't seen this kind of support in previous employment. So that's really good feedback to kind of get from outside as well. The management and leadership is essential to tackling the stigma. There's policies, there's initiatives, and all of these matters, but it's actually the leader's behaviour on the day-to-day that makes the biggest difference. The managers are expected to lead by example about being open about mental health and showing staff that it's okay to talk and that it's safe to talk. They encourage the conversations and they meet with their teams regularly. And they have to challenge stigma if it appears, whether it's in language, attitudes, or behaviour. And on top of that, then they also have to meet all their targets and do their job and kind of make sure all the KPIs are met. So it's very challenging for them as well. So we've invested time in training them and having conversations with them as well, so that they know kind of where everything is coming from too. So leadership, it's not just about compliance and policy or ticking a box. It's about modelling the respect, listening, and creating the culture where dignity is central to everything that we do at Fleetwood. And the direction and hope for the company, I mean, Fleetwood is that they're so proud of the progress that they've made. As a company, we are really proud. You can see it in the canteens, you can see it in people. We had an open day for our 75 years anniversary, and it kind of came back that everybody was proud that they worked here and everything. So the communication was really good, kind of in around that. The change that we've seen gives hope. There's more people talking openly. There's more supports available, and across all workplaces in Ireland are beginning to put lived experience at the centre of the effort. So that's all coming from Shine and from the work that you guys are doing as well. The Green Ribbon campaign is so powerful. It's a reminder that change is possible. It encourages us to take simple and meaningful actions that help break down stigma and open up ever so important conversations. But the message from Fleetwood is really clear. Stigma has no place in our workplace. Your mental health matters just as much as your physical health. At Fleetwood, we're committed as leaders and as colleagues to stepping up and to stamp out stigma. But most importantly, it's important to be human, and it's okay to be human. So that's us.
Wow, Sarah, you're so right to be proud of that.
Yeah.
What a rap sheet to have. That's absolutely fantastic.
Thank you.
And there's such the kind of similar themes coming through about the need for leadership in this, and the need for leadership to be involved, and then the issues companies face, and though you're very different employers, often the obstacles are very similar. So thanks so much for sharing that with us. Absolutely brilliant. And I can testify that beautiful looking walk. I saw some pictures on LinkedIn and it looked amazing. So next up, we have one of our workplace trainers. So Bernadette is a workplace trainer for Shine. So Bernadette delivers the workshops to corporates throughout the country. Bernadette has a long history in working in the corporate area. So her expertise is very much around that. But she's also done the postgrad certificate in workplace wellbeing in Trinity. So I'm going to pass you over to Bernadette now.
Hello, good afternoon, everyone, and I'm delighted to be part of today's discussion. I'm particularly passionate about workplace wellbeing. As Katrina said, 2 years ago, I completed the postgraduate certificate in workplace wellbeing at Trinity, which deepened my understanding of how organisations can create a healthier and more supportive culture. I've obviously recently come on board as a Shine trainer to deliver the 6-step workplace wellbeing programme, giving talks around the country to different organisations. The theme of addressing stigma in the workplace is something that resonates deeply with me, both personally and professionally. Stigma is often subtle. It's not always the obvious remark or discriminatory act. Sometimes it's the silence, the lack of acknowledgement, or the assumptions we make about others that create the greatest barriers. And these barriers can prevent people from reaching their full, work potential. From a corporate context, my experience working within the marketing events and comms within multinationals, I've seen firsthand how culture, shapes behavior. And in many corporate environments, there's still an unspoken pressure, to show up as resilient, capable, and always on. Employees often feel that, personal challenges, especially those related, to mental health, should be left outside the door. This culture, while unintentional, it fosters stigma, and it creates an environment where, people worry that speaking up about stress, burnout, any mental, health struggles that they have could impact or be perceived, by colleagues or managers, and basically this will affect their career progression. Leaders too sometimes avoid the conversation because they don't actually know what to say or fear that they will say something wrong, and why it matters. The reality is stigma isn't just a personal issue, it's an organizational one. It's also a quality and a safety issue. Where staff's attitudes are dismissive, there is a measurable impact around engagement, recovery, and even safety within the workplace. Stigma also touches on dignity and privacy, and when those are not respected, it becomes a breach of professional ethics as well as a human problem. So from a corporate perspective, addressing stigmas isn't just the right thing to do, it makes, solid business sense. A workplace where people feel safe to be themselves is a workplace that will thrive. And at its heart is tackling stigma. It's also about human rights and dignity, ensuring that every employee feels respected and valued. So for me, in delivering the 6-step workplace wellbeing programme, the values of these talks and workshops are very clear. They create safe spaces where people can talk out, where stigma can be named, challenged and reduced. Within the workshops, there's definitely been across, workshops that I've done, there've been reoccurring themes. Managers worry about saying the wrong thing. Employees express relief when mental health is openly acknowledged. And everyone wants more than awareness. They want practical tools and a real cultural change within this area. And when organizations commit to that, the ripple effect is so powerful because employees feel so supported and valued, which is major, and leaders gain the confidence then to respond with empathy, and slowly but surely stigma loses its hold. What leaders and managers can do, so what can they do? It's from a corporate perspective, I believe there's 3 key actions, which is to normalize the conversation. Leaders and teams, they need to talk openly about well-being, just as they talk about performance and what's happening in performance levels. They need to equip managers. Line managers are often the first point of contact, yet many feel that they're unprepared how to handle these conversations. So training them to respond with empathy is crucial. And embed well-being into cultural well-being. It shouldn't be a side project or a tick the box. It needs to be woven into strategies and leaders and values. So opportunities ahead, like the public campaign matters, which is why we're all wearing our green ribbon and our backgrounds today, is Shine's obviously green ribbon campaign. It's so important. It's opening the conversation. It's saying to people, reinforcing, yes, we can talk about this. We want to talk about it. And it's basically getting the stigma has no place in our workplace. This year's theme, obviously, with Shine Green Ribbon campaign is Step Up to Stamp Out Stigma. It's a call for all of us, leaders and staff alike, to take responsibility for this change. And as Brené Brown reminds us, vulnerability is not winning or losing. It's having the courage to show up when you can't control the outcome. So when asking for help becomes an act of courage rather than a source of shame, our workplaces and the people in them thrive. So thank you.
Oh, that's fantastic, and a very inspirational quote to end it on. Thanks so much, Bernadette. And yeah, the themes that you bring up there certainly are ones that we do see in the workplace program, and I'm sure a lot of people on the call today can empathise with that. So I want to move to our final panelist today, Anthony O'Riordan, who is also a workplace trainer. But Anthony has been involved with Shine for a long number of years now. He originally was in our ambassador program and is just slowly finishing up his work there and focusing on being a workplace trainer. Anthony has also completed the postgrad certificate in workplace wellbeing in Trinity, as well as studying workplace wellbeing in UCC. He works at Irish Rail as a train driver and has also started the Wellness Buzz, which provides a variety of wellness talks and wellbeing talks and presentations. So Anthony, over to you.
Thanks very much, Katrina. I often wonder when you're last in order, is that because, you know, I talk too much and I'll keep us here all day and I'll be cut off by the time, or you just keep the best for last? I think I'll go with the latter. No comments from anybody. I'll let you all decide. Yeah, so just to touch on my lived experience, ambassador days, years, talks, that related to it. This time 15 years ago, when I struggled with my mental health in a form of suicidal ideation. And I go into extensively in these talks about what led to that particular difficult time, what happened afterwards, but more importantly, what I learned from the whole experience. And I think myself lucky that I have the benefit of hindsight, that I was able to learn from the whole experience. So in the talks, I tried to share everything I learned so that people might learn from my experience, so that they don't have to experience it themselves should they find themselves in a similar situation. But I eventually went and I spoke with a doctor, and that, along with other factors, contributing factors, I got my life back, and I started to improve. My mental health improved, and it wasn't long before I was, I suppose, thriving mental in the terms of mental health. But apart from talking to the doctor, I didn't talk to anybody about the experience. In fact, it was 8 years before I publicly spoke about the experience. And the response I got was unbelievable. And I think it motivated me. First of all, it made me realise what I'd been through, and how lucky I was. But it also motivated me to learn more about mental health, learn more about my own mental health and how I thought about things, how I perceived things. And that's why I went and studied mental health in UCC. And then I came across Shine, their ambassador program. They were Sea Change at the time. And that's how I got into this. I can remember my first talk was to a company down in Portlaoise. And it was, as you could imagine, very nervous. I'd never really spoken to strangers as such in detail. And they were all male. I can remember them all being male. And it was really awkward the first quarter of it. You know, I wasn't really getting stone-faced expressions on all the attendees. But eventually they began to open up. The more I talked about my experience, they seemed to be more relaxed. And they started to talk. They started by asking me questions, and it eventually led to them sharing. One guy shared emotionally that one of their colleagues had died by suicide in the previous 2 years. So I thought it was fascinating how they began to open up once you start talking about the whole topic. There was another talk. I'll just briefly talk about that. Another male-dominated company, construction company, and that was really difficult for me, in the sense that I wasn't getting much engagement at all. But the shining light towards the end was, following the talk, one gentleman came up to me afterwards. He kind of took his time and he waited till everybody was gone, and he shared information that his own wife struggled with her mental health. I think it was bipolar disorder. I'm not exactly sure, but he said that he hasn't spoke to anybody in his job about this. that he wouldn't feel comfortable about doing it, and he's even lied in the past at dues. You know, if she wasn't there, he'd make something up, and he felt really uncomfortable. Didn't really reluctant to talk about this, his wife's mental health difficulty, to other colleagues. But what finished her off was he said that following that talk, he felt more confident that he could open up to his colleagues, and that really made up for the awkwardness throughout the whole talk. But that would be just a little insight into the benefits of these talks. Personally, in terms of stigma in the workplace, the past 20 years I've worked on public transport, and again it's dominated by male employees. I'll probably have another 10 years in bakeries with the same. And when I recall where I might have experienced stigma, it would have been in conversations, like it would have been a number of conversations around mental health, but inadvertently, say particularly if we heard of somebody who may have died by suicide, and you'd hear comments, and whether it was overhearing these conversations or actually directly involved, you would hear standard comments. You know, what were they thinking? What possessed them? Some might say, why didn't they come and talk to me? Why didn't they say something? I get battled with his demons, and these are all kind of negative. Most of them were negative comments. But where I realized the stigma was, from my perspective, was I had some kind of inside information on how these people would feel, or what they were thinking. Just a certain extent, I know what they were going through. But I'd stop myself from sharing that information. Obviously, because I didn't. This was during the 8 years of silence, by the way, before I even start talking about these things. So I felt I couldn't share my thoughts on the subject matter, even though out of whatever group I was in, I probably was the most qualified to speak on the subject. But that was the effect the stigma had, that I wouldn't share my opinions, and I probably could have shed some light on the whole situation. There are other instances. I know in terms of, as I said, I worked with the public transport. We have a thing where if you're out sick and it's not certified, you have to fill out a form, and you have to write down what your illness was. That has changed since, but I can always remember when I first started working there, you were advised by colleagues not to put down stress. You know, don't put down stress. That's going to raise a red flag. And that in itself is an example of stigma in the workplace, whereas you can't actually talk about what you're going through, and then it prohibits you getting any help, the help that you need. When I think of the 6-step program, which I'm involved with, I've given a few workshops to date. The outcomes that come from it, one thing that jumps out at me is the level of engagement from the attendees. And these are groups of managers, supervisors, and quite often the CEO can be in the room too. And what I find on one particular workshop, the CEO revealed some information, personal information, and you could see the eyes in the room kind of looking around, and that kind of relaxed them a bit more, so that they were able to share their thoughts and their, not too much personal information, but it was a level of engagement where people got to know, people let their guard down a certain bit, and they were able to talk comfortably in these workshops. Other things come from, and it was mentioned before, I think somebody said, I think Austin said, managers aren't comfortable having these discussions, and Bernadette, something similar about the conversations, leaders, do you avoid the conversations? One particular manager said, we're people managers, we're not counsellors. And this whole campaign, it's not asking managers or supervisors to be any sort of counsellor. It's just starting the conversations. That's the most easiest thing to do. It's making yourself available for these conversations. We talk in the 6-step program about psychological safety too, and that's a big thing for allowing the conversation to happen in the workplace. So I suppose I could be here all day talking about the workplace, and we're probably going to be a little bit biased, but I highly recommend them. The feedback has been very positive and constructive, to be honest. They enjoyed learning about the mental health stigma in the workplace and definitions of psychological safety. So there was a lot of constructive feedback. Well, it's in in terms of leaders and managers, what can they do? As I said, I touched on the psychological safety, ensuring that that culture exists. It's, in a nutshell, it's all about communication. And I think possibly Sarah mentioned being a role model. It's starting from the top. Everything has to start from the top and work its way down. Because somebody also said it benefits the individual and the organization. It impacts on the bottom line for the company. Sarah mentioned the absenteeism. When we go through the workshop, we point out there's one statistic in the research: 50% of employers have reported an increase in absenteeism due to mental health. But then we also find we reveal another stat that says 42% of employees are reluctant to divulge that their illness is a mental health illness. So you can see where one research can it conflicts with the other research. So I think that 50% of absenteeism due to mental health could be a lot higher, based on the fact that people don't have that psychological safety, and they're not willing to open up and explain that that's what they're going through. So I think maybe Sarah mentioned leaveism. That's another aspect of absenteeism. It's the same thing. People taking leave instead of going out sick. You know, they are sick, but they're using their own personal leave, and that can affect them too. We come up with another stat that there's a cost of 11 billion to the economy due to the mental health stigma, and about 2,000 euro per employee. So it all adds up, and you can see the cost of the mental health stigma in the workplace. When they look at the regulations and the laws, I came across there recently, and I think Nicola, the CEO, is involved in this. She'll be able to talk a lot more about it. The Mental Health Act is going through a bit of an update at a minute. It's in the Shannon, and this is around one thing that I spotted. The mental health reform made a lot of recommendations, and this is to do with the literacy and the language that we use around mental health. They're trying one particular change they're trying to bring in is changing mental disorder the term mental disorder to mental illness. And some might say, what's the difference, or what's the point? But like, the disorder has such a negative connection to it. It has a negative sounding to it, where illness kind of normalizes the condition. I came across research about alcoholism, just to put it in comparison quickly. I know I'm running out a bit of time, but just to kind of get people's head around the whole reason why we're trying to change the language and the literacy. Alcoholism has been around for probably as long as alcohol has, thousands of years. But it wasn't until 1956 that it was regarded or listed by the American Medical Association as an illness, and it has been so ever since. So when you think of it in terms of the workplace, I know there's a zero tolerance in a lot of organizations when it comes to being under the influence at work. That's understandable. But because it's regarded as an illness or disease, if you came to your employer and said, look, I have a problem with alcoholism, they would approach it differently. Their attitude towards it would be differently. They would work with you to get you the support. They allow you the time to get yourself together. So there's more empathy, more compassion around a subject that's regarded as an illness or a disease. So that's my way of trying to get people's head around why it's so important to change the language that we use or the name or how we name these conditions. And it's really important to consider that. I know we're coming to the end, and as I said, I could stay here all day talking, but I will wrap it up there and put it back to you, Katrina.
Oh, thanks so much, Anthony. And I love that piece around language. I just think language is so important, and language really matters. And what you brought up there, certainly the parity around physical and mental health, that's something that we do a lot of work on and is hugely important. I think when people actually think about that and think of other examples of it. We see it in so many different ways, and it is something we'd certainly like to see a change in. But thanks for your contribution, and obviously your own piece around lived experience is just so powerful. I always think listening to those talks, they're kind of the game changer really, because it puts it in context for you. Before we wrap up, can I check in, Alma, are there any questions we need to bring up? And if there aren't, I'm going to touch base with the panelists maybe for one key takeaway each if we don't have any burning questions to answer.
We just had one there about how long does the workplace program take to complete? And then we have another just about where can I find the recording of those webinars. So what I might do once you finish just your little panel at the end is share that webinar slide again so people can look at the QR code and access the website that way. But if you want to answer the workplace program question.
Yeah, that's great. Thanks, Alma. So typically it takes an organisation maybe around 12 months to complete the workplace programme. We did make some changes to it this year to try and aid people going through it, make it a little quicker. We've moved some of the resources to online so that it's a fully hybrid model now. But like just to say to everybody, the workplace program is free. It's fully funded by the HSE, and you can get any info you need on it on the Shine website at shine.ie or email info@shine.ie. Definitely worth having a conversation with one of our staff around it. So just to round out the conversation today, I'm just going to go back to the panelists and ask them maybe just for one takeaway you would leave everybody who attended today with, literally just a 30-second one-liner that you think you'd like to leave all our attendees with today. And can I start with yourself, Austin?
Yeah, I suppose if there was one thing, I'd say, start. I think that's the thing. Like the old saying, the longest journey begins with the first step. I think you need to make a commitment to start. You need to build it into your plan. If you're working on your plan now for 20 to 26, well, now is a good time to actually work with Shine and see how the kind of 6-step program can fit into your plan for next year. And then I think it's about like change is about what you do and every day. So the consistency around your messaging to staff and ensuring that there's lots of different touch points for staff, peer to peer touch points, their leader touch points, formal and informal. So it's a matter of kind of building all of that. But I think the most important thing is, start on the journey.
Yeah, do it. Yeah, I know, absolutely. I agree with you. Sarah, can I ask yourself for your key takeaway?
Yeah, so I suppose it'd be something fairly similar to actually start the process to make the plan, and to remember that everybody in the workplace, they have lives outside of there, so their mental health is just as important when they're in the workplace, to have that strong leadership that will actually support them is huge. And that feeling of being able to come to work and just be human is so powerful. It's, to actually stand there and be able to say, do you know what, today I'm not okay, or to give somebody that space where they're kind of standing there going, this is such a long week, and to actually give them the space to explain why, what's going on, is there something we can help with, or that's huge. So yeah, the journey and that 6-step program is it's been amazing for us here. So yeah, I'd recommend it to any of the businesses.
Great, thanks, Sarah. And then
No
yourself, Bernadette.
Hi, I would say wear your green ribbon with pride, especially in this month of September, and open the conversation to reinforce the idea that we don't want to have stigma in the workplace, and get in touch if you're interested. And myself and Anthony would love to go out to your businesses and talk about the 6-step workplace wellbeing program. Thank you.
Yeah, brilliant, great advice. And Anthony, last but not least, of course.
Yeah, I think conversations, talk, and that seems to be the common thread in today's webinar. And it's the leaders ensuring that it's okay to have those conversations, but don't just wait for your leadership to do it. If you're just an employee in an organization, start the conversations yourself with a friend, with a colleague, one-on-one, discreetly, just to get the ball rolling. You'd be surprised.
Yeah, and anyone can order the green ribbons from us on the website. You don't need to be in HR. You can order them to your house yourself. And also, just if you want to join the rest of the webinars that we have coming up, we've one next week and the week after, and the recordings are on the website. They're all available through the QR code there. So I guess on this important day, September 10th, World Suicide Prevention Day, thanks so much for joining us today. We really appreciate you coming along to the webinar. I want to really thank our panelists for giving up their time today in doing this. It was absolutely fantastic to hear from you all, and from the team again that helped to organise this. Thanks so much. Take care.
Great. Bye now.
Thanks, everyone.